All right, Jamie. So I'll let you go ahead and introduce yourself. I'm super excited to have this conversation, get this word out, and just hear it from your perspective. Because the reality is, when I see, don't want to mention Z-Dog and everybody, like it's just like, it's so hard to really get a handle on who's telling the truth, because I have multiple different nurses as patients or clients in my office locally. Obviously, we don't have an outbreak in Tennessee, supposedly. We're not ground zero. We're not the prime areas of the coronavirus outbreak, but it's like the nurses are like, one's like, they're doing nothing. We get off from work early. We can come and get our adjustments. There's nobody in the hospital. We're testing everybody. I mean, they've got all their tents set up and stuff like that. They're in the triage. I've got one, she's like talking people, like she jokes around. She's like, I'm talking people off the cliff, even soldiers who are deathly afraid that they're going to get COVID and every symptom. Like, oh my gosh. And she's like, you're a young guy. You're healthy, right? Yeah. You're not going to die from this infection. Just stay home, hang out, drink plenty of water, and you'll be fine. But yet nobody's in the hospital locally, but yet you hear we're running out of equipment.
Yeah.
So I don't know.
Yeah.
Why did you want to speak out? Who are you, in essence, if you want to tell the world who you are?
Yeah. So thank you for having me. So my name is Jamie Arroyo, and you don't ever have to get that right.
I was just going to say, how do you pronounce that last name again?
It's Arroyo.
Arroyo.
And I am a family nurse practitioner. I have been for 5 years now. Before that, I was a critical care unit nurse. I did night shift all through having babies. I have 4 kids. And so night shift was nice, because then they didn't know that you were gone per se, and then you could be with them in the day. Never slept. I was like the walking dead.
Not your patients didn't know you were gone. Your kids didn't know that.
My kids didn't know I was gone. Yes. I was very present.
Clarify that real quick.
Yes. I was very present for my patients. Awesome. Really love what I do. Always have. But, as a, brand new wide-eyed nurse, you come into this field and you're so excited because, most medical professionals have some bit of good in them that propels them into this field. Not just nurses, but every spectrum of this profession, right? And I quickly, it became hard to not get jaded, being in a critical care unit, and seeing, I've put my fair share of people, not to be morbid, but in the morgue. And I didn't want to do that anymore. So I went back to school and got my master's, I think with my second kiddo, worked my way through. And I'm so happy to be on this side of care. And not to say I wasn't thankful for that time. I learned so much. But I feel like I'm making the biggest difference with what I do right now. And I have my own clinic. It's called Hopewell Family Care. And we're in Hermitage, Tennessee. But the reason I even wanted to have this conversation today is because there were some very real things that happened during my time in the critical care unit, that this COVID situation has made me think about, and it's come full circle. I almost felt crazy one night. I was like, oh my God, I need to get a cork board and a timeline to connect what was happening in my brain. I kind of felt like a little bit of a crazy person, but it was a big, almost deja vu moment. Like I was like, I've been here before. When was this? And I had to think back, and I was like, this was 2009. I was pregnant with my second, and we had the swine flu, and the viral code that everybody knew then was the H1N1. That's what everybody was talking about. And I was curious. I was like, you know what? I wonder if we had social media back then, whether you
to the
know,
degree you
this
do now.
amount of fear would have been generated then. I mean, it's impossible, right, to figure that out and know if it would have been the same. But what I can speak to is that the amount of fear that was kind of being pushed in the hospital was the same. And some of the things that I went through were kind of crazy now that I'm thinking about it. You know, I was almost 10 years younger than I am now. And my dad's favorite thing to tell me is, Jamie, you don't always know what you don't even know, you know?
Yep,
And
exactly.
so, and something that I have tried so hard to do here in my clinic is educate and bring my patients along in their own process, because I think that in the general medical community, we have our own epidemic of fear driving decisions. Yep. And that's never a good platform ever to make a decision from.
Yeah.
But that was what was pushed on us as nurses. And I remember them coming out with this new vaccine. It was impossible for it
You're
to have
talking
been
about
well tested.
the H1N1.
For
right?
H1N1 vaccine. And, you know, they told us that it was thoroughly tested, which if you look at the timeline, that would have been impossible, like just scientifically impossible. But they started pushing it on all of us. Basically, first they played to our morality. Like, this is, you know, good ethics. This is your responsibility. Yep. You owe it to your patients to keep them safe. You owe it to your coworkers to not get sick and then leave us short-staffed. You know, so they played to that. Yeah. Then they just outright started bullying the few of us who hadn't succumbed to or agreed to get it.
Well, I was just going to say, this last flu season, I have a patient of mine who, she's a nurse and she works in the hospital. And of course, everybody's forced to get the flu shot, but she refuses. And she has to refuse on religious grounds, basically, and fight it. And she did. And she's literally covering shifts for her coworkers who are sick. Yeah. She's the only one who hasn't missed a shift and has filled in for her coworkers who have all gotten the shot. One of the things that breaks my heart is the pressure that is placed upon both the nurses and even some doctors, that they know what is right. They know that they don't want the vaccine. They know it's not actually protecting them. It's not protecting their patients. They know the truth. Hospitals push it because there is financial incentives for the hospital. If flu vaccine percentages of co-workers, even if they work in the hospital or they work at home. I literally have a patient who works on pre-checks for insurances for elective surgeries and things like that. And she does that from home in a different state than the hospital. And they literally pressure her hardcore to take the flu vaccine. And it's like, I'm at home. Why does it matter? You're telling me the same thing you're just being told. It's almost like, no, that script doesn't work when I work from home. The script of me protecting everybody else doesn't work. You're using a script to try and make me feel bad, but I'm at home, so I put nobody at risk.
Well, but the interesting thing is, like, you know, the next crazy part, which it actually just hit me when I was thinking through this time around, but they made us wear these huge buttons. So, you know, I had all my coworkers had blue buttons, and it said, "I got the shot because I care." And then I think it rolled out like 2 weeks after I had been refusing it for about 2 weeks. And literally a lady sitting at the exit of the only way you could get out of the hospital by a table every day badgering me. You know, you need to get this. She made me sign that piece of paper. I don't know how many times. I'm like, I have already signed this, that I'm not getting this, you know? So then they rolled out these buttons, and mine said, "I wear a mask because I care." And essentially it was a sign, like a scarlet letter, but it was essentially a big HIPAA violation on my scrubs, letting everybody know my vaccine status, so that peer pressure then could play its course, and all the nurses are scared of me because I don't have the vaccine, or they're just like, you're plain stupid, or you're irresponsible. I mean, I was bullied for months.
You should have wrote. You should have wrote that button.
And at first I was like, I got a button, I'm cool, I'm a rebel, nobody, and then it quickly got old, and I started to feel, I don't know, they made me start questioning things. I was like, should I get this? And, nurses are inherently sacrificial people. It's like part of your DNA, your genetic code. Even nurses are signing up to go to New York because we're almost, I don't know, we almost have like weird masochist tendencies where we're like, we're going to be saviors and, save everybody. So you tell a nurse these things long enough and they're going to likely give in. Now, I was pregnant and very sassy, so I think that's probably my child is probably what saved me. But at that time, like, I didn't even know I had some like genetic mutations and different things that it would have gone very badly if I had gotten it. But regardless, I had to endure that for a long time, and it was not right. And my heart goes out. Like, I have a nurse who's like my kid sister who's working at a hospital downtown, and she's new. And man, nursing protocol is like pushed in your whole entire nursing education. And I'm like, they're going to push her into getting this. And it is not going to be well tested. And regardless if it's well tested, they're not going to give her a choice. And that's like, I don't know, both of those are big issues to me. But I don't know. I want people to know that this is history repeating itself.
Yes.
I saw where this was going to go like months ago because I lived it. Like, I already lived it once. I know fear is like what they say, the opioid of the masses, right? And so like you push people long enough and hard enough, and sometimes they just kind of like mentally give up and like, okay, if we can just get everything back to normal, we'll do whatever you want us to do, But I'm already concerned because our medical population, like, we don't have enough nurses already. We don't have enough doctors already. It's a struggling field. There's not enough people.
And you're concerned because, and I want to clarify so that everybody else understands this, you're not scared because we don't have enough nurses to handle COVID or coronavirus. No. You're scared because you don't have enough people who are going to stay within that profession when there are sick and suffering people in this world. Much of it self-inflicted or inflicted by the environment that our society places upon economic, statuses and just, basically. Well,
I'm very concerned that this vaccine that I know is going to come down the pipeline is not going to be well tested, going to have the same effects that it did on a lot of doctors and nurses. I mean, if you look up the havoc that was wreaked off of this first set of people who were basically tested upon, with this first H1N1 vaccine, there's a lot of them lost their jobs because they could not function after getting the vaccine. They had all sorts of neurological issues, even anything from narcolepsy to muscle weakness. And I mean, like, when you're a surgeon, you have muscle weakness in your hands, you're done. Yeah. And so I'm concerned that, I'm concerned for our whole population, but I'm concerned for these frontline people who have already given so much, who have like put themselves in harm's way, maybe, but then they're going to, be almost demonized for not
taking and accepting a vaccine. But I've got articles from way back in the early 2000s that said that like less than 40% of medical physicians and nurses would accept a flu vaccine. And then it was within a matter of a few years that they basically, through lobbying efforts from the pharmaceutical industry, they lobbied to push for regulations and reimbursement policies for Medicare. Medicare makes up a large portion of the reimbursement to hospitals. And I forget if it's like 3 or 4%. If the hospitals didn't reach a certain percentage of vaccination rates with the influenza vaccine, that was their monitoring, that was their statistic, then it would be 4%, possibly 3%. I can't quote exactly because it's been a long time since I read that, those bills. But that basically made a hospital see that, and that's upon all reimbursement. That's not for vaccines. That's for any foot surgery, any emergency department, it doesn't matter. Anything the hospital does, that would equate to millions to billions to trillions of dollars nationwide in the hospitals if this hospital does not get or force their employees a certain percentage to get that vaccine.
Oh yeah,
so
and
they don't. It's not about.
It's a quota game.
Yeah. So it's like if doctors and nurses weren't willing to willfully and accept the vaccine and desire to want it, that should have told everybody in society that something is wrong here. If the people who are saying they're the ones who are supposed to be administering these measures, vaccines, whatever it may be, they're not even willing to accept it themselves, and they have to be forced to accept it. That should call into question vaccines in themselves. If you as a nurse and you won't willingly, you have to be forced. It's like,
and I'm not, obviously, again, my genetic code is to want to help people. Never would I ever want to put my patients in danger. But do you know that I did wear a mask faithfully, and I washed my hands faithfully, and I was the only one in that unit that did not fall sick to flu for several years running. And I'm the one that had to work harder, to make up for when we were short staffed. And so I don't feel like I was irresponsible. I don't feel like I put my patients in danger, but I was like, man, the mental fatigue from being told you are, it wasn't right.
You should have put on your button. You should have put on your button that wearing a mask is the only thing validated by peer-reviewed scientific evidence to reduce your risk as a patient of contracting an illness from me.
Yeah.
Flu vaccines have not been shown. You look at Cochrane Database of Systematic Reviews, you look at the meta-analysis of the research on influenza vaccines, they do not show. Time and time again, you vaccinate every single staff member in a nursing home, and guess what they found? There was no reduction in influenza-related illnesses or pneumonia deaths. So it's like the science does not support it. So it's like everybody should be wearing a mask if you wanted to, and that's when you're in direct contact with patients who are extremely susceptible. That is a barrier. That is logical. You know what I mean? Because somebody with another bacterial infection then exposed to the influenza or the coronavirus, and coronaviruses is a class of viruses. It's not a single virus. It's not just COVID-19, it's many. So it doesn't matter if it's rhinovirus, sinus infection, or coronavirus, or influenza. It doesn't matter. If somebody has a bacterial infection, then you introduce into their body, into their system, another virus that their body has to take care of. Of course, they're going to be at a lower potential to be able to recover. And so it makes sense in that environment. But something I definitely want you to touch on in this realm right now. You said to me when we talked on the phone that you do viral testing and stuff with your patients, and you had patients coming in with pneumonia or bad coughs. And I saw more people had a worse cough this season, but that started back in October. So this storyline that the world has, that I'm seeing Marsha Blackburn in Tennessee say it's China's fault, China's fault, China's fault. One, I want to know why you're not questioning University of North Carolina, Chapel Hill. They engineered a bat coronavirus. They're silent right now. They were supposed to, according to what they were doing in 2015, was supposedly create that virus to be able to infect human beings. And they took it from a bat from China. They took that and created that virus to infect human tissue cells, lung tissue cells. They were supposed to be developing a drug or a vaccine.
I know. I'd love to see the end product.
So what did they do? They didn't do anything with that information, that
virus
they created. Did they sell it to Wuhan? What did they do with it? They're not even talking about 5 years of science. They were supposed to be using their creation to develop, to supposedly save humanity for this time right now, supposedly. But
at least say it's not us, but they haven't said anything.
I know.
They haven't, not a peep.
I'm like, what are we doing? Do we really want to piss China off? I'm pretty sure they're a world power, and they probably could do a whole lot of harm in this entire world if we piss them off enough and want to try and point the finger at them. But again, my point is, we had people infected with an unknown cause of pneumonia back in October, November in this country. And you were doing testing, which wasn't identifying what you could test for. You couldn't identify. Tell us about that.
Yeah, so we have a genetic panel. We see all the way from little babies to grandma and grandpa's here, so like the whole family.
Yeah.
And so we were testing all ages. And this genetic panel it's not a genetic panel. It's a company called Genetic Assays, and it's a viral panel of 26 different respiratory pathogens, both bacterial and viral. And
are you testing for the presence of the virus, or are you testing for, like most people would consider it, testing for the presence of the virus or testing for the exposure to the virus? How does that
we're testing for the presence. Like there's actually
Okay.
a quantitative
Yep.
number that shows us. And I was getting negatives with some really sick kiddos. And
Yep.
I remember my colleague Darby Sangre and I looking at each other and going, what is going on? And this was in December. Even late November, January was really rough. And people just coughing for weeks and weeks and weeks. And I still don't have an answer, but it was not any of those 26 things that we normally test for, like rhinovirus, RSV, all the coronaviruses, the family of those.
The ones they knew of, or
the ones they know of. All of those were negative.
Yeah.
Pertussis was on there, mycoplasmic pneumonia, all the common ones that just, and I was sending healthy people that have never had a problem to the hospital for chest tubes and things like that. And the moms having follow-ups with me going, what is wrong with my child? We have never experienced this before. It was not influenza A. It was not influenza B, any of those. And so we were left with this mystery virus that we didn't know what was causing these issues. And our office manager and then her assistant, Emily, they're like, we've already had it, guys. We've already had it. And there is a company we work with named Allometrics who is trying to get out an antibody test to us in about 3 weeks. We're hoping to have it.
On that subject of antibodies, I'm going to do a talk here soon about antibodies. Antibodies are not what we perceive them to be. We perceive that once we have antibodies that we're immune and we're going to neutralize that virus and we're not going to become infected with it again. But they show through the whooping cough vaccine that you actually will have higher antibody titers, IgG antibodies, than if you become naturally infected. Your antibodies are higher in your blood, but you don't have antibodies to IgA, and IgA is a neutralizing antibody at the surface mucosal membrane, and it's non-inflammatory. And that's one of the things, like the high titers measles vaccine, what did it do? It killed God knows how many children, and they tested it on poor communities, I believe in LA or somewhere. You look at vaccines, they can stimulate antibody responses. So what if they just say, you know what, and antibodies go up during initial infection, and they decline fairly rapidly. The body doesn't need those there. The body, if it has the right ones, it's going to neutralize it before it gets into the systemic bloodstream and need the IgG antibodies. So this concept that they're going to come out with these tests and we're going to test and see who's exposed. And if you're exposed, as long as your antibodies and titers are so high, then
I'm a little bothered by it, because I'm like, you might test negative but you be just fine. So I think it could, I don't know. I think it's going to have a pro and a con. I think it's going to get some people into the workforce, but then it's going to make other people susceptible to mandatory vaccine when they're just fine. And so I don't know. It's a little bit of a conundrum. They've done a good job of pushing us into this corner.
And when you were, I tell people, like, these people are not stupid. The people who are pulling the strings, they are intelligent. And no, it is not some big conspiracy where every single medical physician, every single hospital, every single nurse is in on it. You know what? People are like, do you think Trump's in on it? You conspiracy theorists. I'm like, I believe he's a businessman who knows how to make some money. He knows how to run a business. And you know what? Good businessmen in those positions, they usually have smart people around them. And if those smart people are deceptive, if they are evil, if their desire for money is greater than the desire to actually do right by people, then he is being deceived. Nurses are being deceived. Doctors are being deceived.
Well,
Nurses and doctors,
everybody, in history, anytime something like this comes across, you're going to have, people doing good, and then you're going to have people using it to their advantage. And so this isn't new. This tale is not new. It's just what we're experiencing in 2020 now. But they did set the platform for this in 2009 when they changed the WHO changed the definition of what a pandemic was.
Yep.
And they did that so that they could issue a pandemic so that all of these, countries like Germany, Spain, UK, US would purchase vaccines, which they did. Oh boy, did they. And then they got ridiculed when their people didn't line up to get them. Then all of these like Glasgow and Baxter and all of these vaccine companies were like, well, you can save them for a rainy day, or you could try to give them to the countries that don't have any, and you can just give a donation. But they sure weren't going to give their money back, after they did the hard work of changing the definition. But they completely removed, I wrote it down, they completely removed the portion of the phrase that a pandemic includes enormous numbers of death and illness. That part was removed.
The active several.
Well, they shortened it, and it's now an influenza pandemic may occur when a new influenza virus appears against which the human population has no immunity. But they removed the enormous amounts of death, that part that is kind of important, before they sounded the alarm. So
to me, it just shows how ridiculous the World Health Organization and these policymakers and the way they write it specifically so that they can deceive people into believing that just because we have a new virus that we haven't come in contact with, that we have no immunity. 60%, 60+% of people who come in contact with a circulating coronavirus, and this one currently, have zero symptoms. Zero symptoms. Their immune system neutralizes it. They're sometimes neutralize it at our mucosal membrane, sometimes neutralize it efficiently within the bloodstream without enough inflammation to actually bring about symptoms, no fever, nothing. So it's like that status of that individual who's capable of doing that, we need to figure that out. And that's what I know, I'm sure, just talking briefly, you do that in your clinic. I do that in my clinic. We need to do more of that. Meanwhile, they don't really care. It's like, the people pulling the strings, not the nurses like yourself, nurses at the hospital that are literally doing CPR to save a person's life. Those people want to save lives. They're not the ones dictating the research that's done, the policies that are made that could actually bring about a way in which, hey, let's test everybody for nutrient deficiencies when they come into the hospital with a bacterial or viral pneumonia. And then let's make sure we correct those as quickly as possible, because there is no freaking drug that's going to save a person's life if they are so deficient and depleted of any one of the essential nutrients or vitamins necessary to mount a proper immune response. There is none. There will never. There's no amount of ventilator that can save a person's life once they completely deplete any of their vitamin storage. It's a link in the chain that, if broken, if lost, is going to destroy that person's life and take that person's life. But why aren't we doing that stuff?
It's a mess. Sometimes I wake up and
that's all you can say.
Like, are we here? Like, is this really happening? I do hope that I don't know. I'm looking for the silver linings. I'm trying to be that optimistic person that's like, are people waking up? Are they realizing? Are we gonna even question like our sick care? Because it's not well care, it's sick care, where people are on all of these medications that actually inhibit their ability to fight infection. Are we going to wake up to these things? I know every patient that comes into Hopewell Family Care, we try to educate them, but that takes time. It takes so much time. And so I'm thankful for people like you who are doing what you do, because people need to hear this. They need to hear it, and they need to hear it more than once. It takes repetition. When you've been told one thing for a long time, after you deconstruct something, you have to hear the truth several times for it to even sometimes like take hold and set in. And that could be scary for people,
Something is deconstructing something, kind of go back to deconstructing that idea that this virus was likely around way before the storyline of the the World Health Organization and others and the media is that four cases of pneumonia with unknown cause in China were reported to the World Health Organization. Let me ask you, when you were a critical care nurse in a hospital caring for people, you cared for people with pneumonia, right?
Correct.
If you guys could not determine the cause of that person's pneumonia, did you always report that to the World Health Organization?
Not once.
What? So somehow China decides to report 4 cases of unknown cause. You know, I have more than 4 cases in my clinic where they went to their medical physician, they went to the hospital with the cough and cold, with pneumonia, got diagnosed with
Oh,
it.
yeah,
Oh,
yeah. I have way more than that. Yeah,
it's
so
not
many.
strep and it's not flu, but we don't know what it is, so go home on antibiotics. That's literally what I heard. And most of my patients, they're not going to take the antibiotics. They're like, okay, let's just, we'll just know the body's going to fight it off. The majority of people, I'm like, as long as you're doing the right things, you're not deficient, you're going to fight it off. Your body may be coming in contact with a new one. It may be a little bit rougher, but you're going to get through this, no problem. Nobody, not a single client or patient of mine that had it has died,
Yeah,
and
it's interesting, and then to touch on even the death certificate situation, I was
yes,
like,
please.
man, does nobody in science, like if you are a true scientist, does nobody feel bad about this? Because this is like breaching every single thing I learned in my grade school science class about, science is supposed to be very black and white and rigid, not all this gray and like, oh, if it
Just
kind of if it
assume. They
smells like
literally
it, maybe we should write it down. And it's just, to me, that's like, don't scientists feel a little bit like angered by the fact that, if they love their craft so much, it's just getting crapped on right now.
Yeah.
So I don't know. That part's interesting to me too. But I do hope that as people make decisions into the future, that they really don't do so based on fear, that they can know that they can leave a clinic or a hospital or wherever they're at and not be a bad person if they want to leave and take some time to think about whatever they are pressuring you to do or pushing on you, that it's your right to take time to make decisions.
I'm glad you're willing to say that.
What'd you say?
I'm glad you're willing to say that as a nurse, because we need more nurses who will speak up and say that type of thing. And we need more nurses, you're in a family practice now where you can work and educate and inform and actually truly prevent health problems, chronic illnesses, diseases, infections,
I'm
everything.
glad you brought up though about the vaccine bonuses, because it's like it's difficult, like even taking insurance and being an integrative practitioner, because they do really like restrict what we can even do with our patients. And I lose, I don't know how much in bonuses per year because we don't carry vaccines here. And so there's a lot of like, I don't know, it's a question. Like all of the integrative nurses in my area were like, can we even stay open?
Yeah. Well, it's do the right thing.
Right.
Or make a lot of money. Which one do you want to do? In medicine, do you want to do the right thing or make a lot of money? And there is money to be made, but not nearly the money that it is in just being what I call a drug dealer or a vaccine pusher. If you're a vaccine pusher and you're a drug dealer, you get to sit back in a comfy chair, spend a couple seconds with your clients, or just send your nurses in to administer the vaccines or prescribe the drugs. Once you as the doctor look at the symptoms and say, okay, give them pain meds and muscle relaxers because they have back pain. Oh, they have a sinus infection, possibly sniffly, runny nose, and fever. Go ahead and give them some fever reducers and give them a prescription for an antibiotic.
Fear takes 2 minutes, and education takes 30 minutes. And so, it's not a moneymaker at all. But we need more people, and every time I come across someone like you, I get encouraged that there might be more of us than I think there are, maybe.
I think there are. We need more of us to speak up. Like really, really speak up. In this time, I think it's very ironic, but very definitely timely. My pastor told me to read the book Bonhoeffer, and it's about a pastor that was, he was a pastor during the rise of Hitler. And literally the church, they had the German, the Third Reich, I believe it was, and the Aryan nation, they had a church, the Christian Church of Germany, And it literally was strategically done to rewrite it according to be able to say that we can kill the Jews, we can kill the disabled, we can do all this. So they really rewrote and rebranded Jesus Christ, and they did all this demonic evil stuff to manipulate the minds of society. And they literally got away with manipulating Christians or people who called themselves Christian. They manipulated the church within Germany, and he spoke up against it. They became, instead of the Third Reich Christian Church, the German church, German Christians, they became the confessing Christians. And he asked and begged, and he went around and he talked to churches and pastors and asked them, this is wrong what's doing. You can't rewrite the Bible. You can't be listening to Hitler. They are literally persecuting and they're killing Jews. We cannot let this continue. We must speak out. And as Christians, he was like, the very least the Bible asks us to do is speak for those who cannot speak. And to me, I like just thinking about vaccine injury and autism and all these things that medicine induces upon our society. We really need to speak out for those who cannot speak in that realm. But right now, as people are being deceived into believing that there is nothing their body can do to fight this infection, it's brand new. So it's like no one's immune, everybody's going to die, and we must just do what we're doing now. It's insanity. They're being deceived to such a great deal.
Yeah.
We need more people who are willing to speak up. We need it, because powerful thing. Let me share it because it's in my head in that book. He basically said something along the lines of, what good does God have with your worship if you won't speak up against evil in the world?
Yeah.
Like, does singing a song praising Jesus, your praise, does it really do anything for Jesus if while you're singing, you could be actually speaking up against evil that is deceiving and taking people away from knowing God?
Yeah.
And in this time, I wish more people would speak. And like you said, we have more people. We need more people to speak. We need more people to be out there fighting to reopen, but not only just reopen. We need to almost take this opportunity not just to reopen our nation and our states, but to educate people on this, because this model, this quote unquote prophecy that scientists had, that this was going to be the worst epidemic and we were going to all die and millions of people were going to die. That was like science is the God. These scientists are the chosen scientists who were prophesying this horrific epidemic and pandemic that was going to kill millions. It drove people through fear to do and allow what we're in right now. That is, one, devastating lives of people that it wouldn't have negatively affected. But ironically, more people are living in, we're at an all-time low in our weekly deaths because they stopped all elective surgeries and procedures in the hospital, which is one of the leading causes of death.
Yeah.
So it's like an irony here.
Yeah, we're in a interesting time. I know in Kohelet it talks about how like there's nothing ever new under the sun. Like whatever we think men could have, reinvented or come up with, it's not new. Historically, we keep telling the same story over and over again. And I don't know, I might identify with Moses a little bit, not like I'm a nation builder or anything like that, but that I like, it's scary to speak. And that was like his first thing, like, nope, God, I'm not a good speaker. And I think a lot of medical providers who are in a place to speak truth and literally bring deliverance to people, are in that position where like, I'm not a good speaker. But I would just encourage, if anybody's listening who's, a nurse, a doctor, physical therapist, chiropractor, whatever scope, like this is your time to speak. And that's even what the German Christians are faulted on, is that they didn't say anything. Like they kind of stood by, and I never want to be guilty of that. I've been given a lot. I've been entrusted with a lot, and when you've been given a lot and been poured into, like, you have a lot of responsibility. And so I'm definitely feeling that now. I hope other people do too, because it's important. We don't have like the biggest window of time to kind of turn the tide as far as people's thoughts about this. That government and people whoever is taking advantage of this, they're several steps ahead. And I'm not saying that to like induce fear, but just say like, don't have a ton of time to like speak the truth.
I mean, what I've been trying to put out there, like the CDC saying that next year it's going to coincide with the flu. I'm like, no, actually, your 2019 published study that I reviewed back when I was talking about how Fossey predicted that in April we'd see the decline. I'm like, well, that's because when you studied the coronaviruses, and because this is a possibly different coronavirus, maybe it's laboratory originated or created. No one will really probably ever know for sure, because unless somebody confesses to doing it, you know, you know what I mean? Like, it's all hearsay. Unless North Carolina confesses that, yeah, it got out, or yeah, we sold it to Wuhan, or did it get out in Wuhan? But I'm like, it didn't start in Wuhan, I don't think, unless it started in Wuhan and they really covered it up well. And then it got over here in October, November. I'm like, it's like, this was around, and it probably was around during the summer, but like coronavirus was seen in 2016 to 18. Coronavirus infection rates are a seasonal infection. They are a seasonal virus. They go up in October, November, and then they decline in February to April. Every year they do that. And this is a coronavirus. It will follow that same pattern. It may be a little bit harsher, like we have different years with the influenza. We have harsher influenza strains than others, and it depends on the population that had heterosyptypic immunity. Yeah, it may be a new virus, but you have heterosyptypic, which is, it's a different virus, mutated differently, but it's still the same class and family. If you have that prior exposure to anything in that class, you have some level of priming to be able to fight it off more efficiently. And that's what we want. And the only way to get that is really through exposure. It's exposure.
Not social isolation.
Not social isolation, not vaccinations. And vaccinations actually hinder that.
I was thinking about that, because having illnesses and viruses, actually, you probably already know this, I'm speaking to the choir, but for everybody else,
yes, who we're speaking to.
It helps our body detox and actually exercises that immune muscle. And we see so many studies of how these viruses reduce the risk of cancer long term. And so anytime a mom comes in and she feels like guilty, like, how did I get my kid sick? Like, how did this happen? I encourage them. I'm like, your kid's flexing their immune muscle. You're giving them everything they need to do that. Their body's terrific. They're going to just kick this. It's not a big deal. And then they've added that to their repertoire. They've sweated, so then they have detox. There's just so many good things that come from acute viral illness. It's not something to be scared of. But I'm a little nervous, actually, like all of the sickness that I normally would see, obviously nobody's getting exposed, and so nobody is having sickness right now. That in addition, people are pushing off like very important, essential appointments, like checking thyroid, checking blood pressure, checking cholesterol, like all of these things. And I'm like, we're going to have another mini wave of issues come August when we have this collision of appointments that have been put off.
Oh, mortality rate is going to go skyrocketing as soon as they let people back into elective surgery.
I'm like, this was terrible. This is not a good trajectory. So I'm a little bit nervous for that. And I've been really trying to get our patients to just even still see us via telemedicine and in office when necessary, so that we keep on promoting good health and healthy behaviors. And I'm less nervous about COVID and a little bit more nervous about what's going to come down the pipeline here in the summertime if people aren't staying on top of,
So as a nurse, what would you say to other nurses out there that are in the same frame of mind and understanding that you are right now? What would you tell them as far as we have to start? Like, I told somebody that works in a facility that they're going to force masks. And then she's like, I'm sure they'll eventually, when the vaccine comes out, be forcing the vaccine. And I'm like, she's like, I was like, really, when it comes to masks, there's probably nothing you can do, because if it is your employer and they mandate that, you're probably not going to be able to use a religious exemption against the mask.
Right.
So, I mean, I don't think the Bible says anything about face coverings. I don't, again, I'm not a biblical scholar, but that's me. But I'm like, don't wait until it's time for the forced vaccine to start speaking up and at least be educating. I mean, at cash registers at Publix or Kroger or wherever I go, I literally just simply say, hey, Have you guys seen that video about Gates Foundation, John Hopkins, and World Economic Forum, where they talked about Event 201, a fictional exercise to play out a coronavirus pandemic? That happened in October. Don't you think that's a coincidence? Did you guys see that? And I act stupid. People know, some people know who I am. I'll get that out in public. But a lot of times when I travel, I don't. And so I do that in Nashville. I do that in different places. And people are like, what was it? And so they have no clue. So I'm going to write with window paint on my truck. I'm going to write, Google or search Event 201, Gates Foundation, coronavirus, fictional pandemic. I'm going to write something like that. So it spurs on. Then it at least brings about a level of like, hey, wait a minute. Like they did a fictional exercise playing out how this would play out before it actually played out in real life. So I always pose it to people. I'm like, so either you believe that God was behind the Gates Foundation and John Hopkins to play this out, but why aren't they talking about everything they learned during that fictional exercise? Why aren't they talking about, oh, we already did this. We just did this 2 months ago. We know exactly what we should be doing. Let us lead the way. Gates is kind of trying to say that, but they don't want people to know that they actually did this fictional exercise. That was probably a planning party for this whole event. You know what I mean?
Maybe. I'm sure they had a great time. I think for the nurses out there, I think this is, hopefully, maybe it's not been oversaid, but like fear depletes your immune system more than anything else. And so like, make sure you have, good support system around that you can talk to, because nurses and all healthcare workers have a heavy job. Like we deal with people in their lowest situations, and in moments of grief, and that it's a tough job. And then you add fear onto it, then, it's going to lower your immunity. And I'm less concerned about COVID and more so the other things that could be creeping in people's genetic trees right now that are going to be expressed here in a little bit, just due to this chronic stress that they've been under. So get a good support system. Like if you verbalize the fear, sometimes it doesn't have as much power over you as if it just is left to be in your mind, because our minds can go through some crazy trips. Like we have a crazy fear highway in there. Definitely get your spiritual outlets in whatever form or fashion you choose to do that. That has to ground you. And then obviously, giving your body what it needs, like sleep is huge. Laughter is huge. Movement is huge. These things that make us human. And I think that's a lot of this, a lot of what the media has taken away from us are these like very integral things that make us human. I've been trying to have a little bit of fun with like, I don't know, TikTok and the media and different things like that. But there's a really funny one right now about like, put the mask on, don't wear it. Make sure it's next to your face, actually on your body, don't wear it. If you wear it, nothing will happen. Like it's just all of these things.
If they're not wearing theirs,
mine will comedy in it, and posting things on my Instagram for my followers. So they're like, they can laugh, because we need to laugh. We need to find our humanness again. And I think if we all concentrate on that, we might come out okay and unscathed. But if you're in a position of getting bullied via vaccine, I would call your senator. I would, for what it will do, but do the things, call them, call your managers, start getting emails to your CEOs, find your articles, get your crazy notebook of your rights as far as a worker, because I think we're going to be there in 2 seconds, and you need to have a response formed. I'm probably going to be doing the same, because I think even our practice will come into question. Like, what are you guys making your employees do? We've already been under the microscope several times, just because we're integrative. Must be bad, right? But anyway, I think those are some of the things. But never in a situation that you're being bullied, never in that moment, like make the decision. Because I almost did a few times, and I would go home and I would think about it, and I would ground myself, and I would come back the next day and I'd be like, no.
The number of times I've heard a mother say to me that I remember the exact office visit. I remember the way the doctor made me feel about not vaccinating my child. And in my spirit, I knew I shouldn't, but I did. And I've had mothers say I was literally crying and they vaccinated my child. And that's when I lost my child.
It's terrible.
So
It's terrible.
if your spirit says this is wrong, what this doctor's saying to me, what they're trying to pressure me, coercion is a form of medical malpractice.
Yes, it
It
is.
is not legal. It is not okay.
Well,
That is wrong on
that
every level.
mother intuition is like a
Yes.
real thing. And we're taught as medical professionals to listen to it in every avenue but vaccination, I swear. So like a doctor is like, oh, this is the worst headache your child has ever had. Like they listen, that history taking from the mom is so important. And so the mamas that come into here, I'm like, listen, I can't look under a microscope and see your intuition. I can't test for it. There's no lab I can run about your intuition, but it exists and it is integral to you. It's innate, it's visceral, it is sewn into you. I was like, you listen to that and you trust it because it's been put there for a reason. And shame on the medical professionals who have decided that they are God and override a mother's intuition. Like shame on them. And I can't say that enough because there's been so many times where people have come into here and on paper what they have going on doesn't seem so big, but then the mom says, I'm concerned. You follow that, and every single time you'll be thankful that you have. And so I just and the dads out there too, like that they have intuition too. I don't think anybody's going to debate that moms have it a little bit more, like it's in there, it happens when they're that baby's in utero. So, but I just hope everybody feels that they have the right to parent their children, that it's their children and theirs. And it is not a medical professional's child. It is your child. And at that point, you get to determine what happens. And if they don't, go find someone who is going to support you because they exist. A website I've been turning some people to is ifm.org. I'm not a I can't claim a functional certificate. I do some functional things. But ifm.org is a great resource if you're trying to find a provider in your state, in your area. I like them a lot.
We go by the Wellness Way as a group of chiropractors and nurse practitioners.
Oh, great.
You should check it out. And
the Wellness Way? I got to write this down.
We go by I would say the comparison between functional med and what I do, what Wellness Way does is we try to, and I'm sure you do too, is try to go the farthest we can upstream. What I say, medicine is kind of like doctors looking at, and emergency departments looking at what's going on in the Gulf of Mexico. The reefs are dying, fish are dying, and they're like, what's going on? Oh, it's a thyroid problem. Oh, it's a hormonal disruption. Oh, you have a heart problem. And they're like, okay, but they're not looking at what's coming into the Gulf from the Mississippi and what all the streams and rivers, and is your gut healthy? Is your immune system balanced? All those things. And so with Wellness Way, it's more herbally based than isolated nutrient based, more whole food based and that type of thing. So there is a little bit difference there between, I just want to throw that out there since I do work with that organization and love it because it's really where my core desire was originally. And the way I got involved with them was because I wanted to integrate more than just chiropractic care. I knew the nervous system, the spinal structure, stress, all those things. I knew that people needed a balanced diet. They needed to eat right. They needed to think right. They needed to move right. I would have people coming in wanting me to look at their testing from their functional med docs and things like that. And I get these nutrient deficiencies and things like that. And I'm like, okay, so why are you deficient though? You're taking magnesium or zinc or B12 or whatever you're taking because
you're not absorbing.
You're deficient, but why aren't you absorbing or are you using too much of it? And that's where I say we've had to take healthcare in that direction of going the furthest we possibly can with the science and available information we have. But I even told another one of our docs today, I said, listen, in this situation, you are bound by what the lab and science is even going to give you availability to test. And from there, you need to then use your clinical understanding of how the body functions, what the body's telling you, and what the person's telling you, and use that information so that you can guide them and help them in understanding what they need to change in their life, what they need to eliminate from their life, or what they need to include in their life. And what that can be, it's very general statement, but it's like, it doesn't matter whether it's a nutrition or whether it's a toxic environment, whether it's a relationship or what it is.
Yeah.
You need to figure those things out.
Right.
So,
and I do feel like, you know, whatever discipline someone is going to, because there's just a varied amount. And I love working with reflexologists and chiropractors, and I feel like we make a great team. But if you get to somewhere and you're not allowed to ask questions, your flag should go up. Like that red flag should go up right away. I'll never forget, we had, because we take Medicaid, we had to go to some mandatory like vaccine seminars, and I was like, you know what? This is actually going to be kind of cool, because I'm gonna hear all the inside stuff. And boy, did we! I like was screenshotting some of these slides that they were basically saying things like, "Do not give parents information on Gardasil, because then they will ask questions, and the more questions that they ask, the less likely they will be to get this vaccine." And so
can we have you back on and you take us through those screenshots?
Oh, I'd love to do that. I do that for all of my
medical training and CEUs inside look at that.
Oh yes, I have certificate I can show you. I have
right.
I think I got a whole 2 CEUs from that weekend, but they're basically like, do not involve parents in any part of this process. Make sure that they don't ask any questions, because at the end of it, they will not want the vaccine.
If you're unwilling to and you don't want to, like I literally probably get myself in trouble educating my patients too much, like taking them down rabbit holes. And now have some patients, they just sit back and, okay, so simply what am I supposed to do? So antibiotic, like they're like asking, I'm like, okay, just do this. And they're like, yeah, okay, cool. I want to keep it simple, doc. And I'm like, sorry.
Yeah, I some days I go real off and I see the look in their eyes and I'm like, I went too far. Too far.
Why don't flags go off in the minds? I'm sure it does for some, but in the minds of why don't they do anything about it? If you are being trained to deceive, and you are deceiving as a medical physician, if you are restricting information, if you're restricting truth, you are deceiving people, in my opinion. You might be not directly lying to them, but you are hiding things from them. And if you are hiding things from them simply to get them to accept a vaccine for them and their family members, you are deceptive, and that is an evil practice. Only a deceiver will hide in darkness, and that is what they're doing. And you're literally required to go to a seminar for CEUs, for continuing education credits, where they teach you to deceive parents and not disclose truths to them. That is wrong. Folks, you just heard a nurse say, we are literally taught, mandated to go to these seminars to get these 2 credits of CEUs or whatever in how to bare minimum not disclose truth.
We even had nurses standing up going, I'd let you know, because we actually had a Surgeon General from the military talking to us about the Gardasil. It was interesting. And these nurses were standing up and going, you want us to give these vaccines to these patients, but they know more about it than we do. How do you want us to go about that? And, you know, they come in with this, like, all these research articles, like what are we supposed to do in the face of that? And they essentially were like, I think he didn't have a good response, is from what I remember. But even the nurses were getting to this point where they were like, this is a terrible situation, you know, and they get jaded and frustrated. I think sometimes they can even get a little power trippy in those moments, and just because you're supposed to, but they don't have a good reason. Like they're even verbalizing, we don't even know why we're giving this vaccine.
Yeah.
So,
well, probably originally when you went through nursing school and before you became a nurse practitioner, and your eyes were open to the reality of like medicine and vaccines and the wrong and the harm that can be done, you know, and the manipulation and the deception, you probably were like, my heart is to help people. And you were taught, you were trained, you were led to believe, you were, in my opinion, there's a lot of nurses that are deceived into believing that vaccines are the way to save lives, the way to protect children, that if they don't have them, their immune system is deficient, or they don't even have an immune system. It's ridiculous what nurses will literally spout. But it's like, and I had to check my own heart at times because I get very frustrated and angry that they don't know the truth. But then I've got to remind myself they were deceived by somebody else. You know, the people who are writing these textbooks, they are literally restricting information that is handed to a nurse. And so, like you said, these nurses are asking at these conferences, like, we don't know how to answer these questions. These parents are bringing in research studies and we don't know how to respond to that. So give us information so we can understand. But then the people training them don't even have the answers and information to answer the questions about the research. So they're like, don't even answer the question, just do it. Because I had patients, literally parents, take a stack of like I printed out like a stack like this big. Parents took the research studies to their medical physician and said, will you at least take a look at these studies on the DTaP vaccine or DTaP, you know, and others that are showing harm and increased infection rates, and these are federally funded studies. Will you take a look at this? And the doctor said, no, we do what the CDC states we are supposed to do. We vaccinate according to their schedule. And if you're not going to do that, then we don't have a place for you in our office.
Yeah.
And
I feel like even our clinic has become like a haven for people sometimes who have literally not been to a doctor in 5 years because no one will see them. And I'm like, oh my gosh, you guys are becoming the underserved demographic and like having no access to care. Like, shame on our medical system that doesn't give people choice and just kicks them out at that point. Like, what is their recourse? I mean, they need to be able to be tested for anemia and allergies and stomach pain, all these things. And they can't they can't go anywhere. And so I don't know. I'll never forget in my master's program. This is my master's program. So this is not even undergrad. This is master's. The dean was speaking to us about vaccines, and there was no immunology, no chemistry, no biology. I could sum up in 5 minutes, or she basically gave us like a 15-minute talk about vaccines. And she said, I know you're not supposed to give them when a child has a fever, but my MO is give them all and give them extra. That was what I was taught in my master's class. Everything I know, I had to go research it myself. So I think you're right. You know, just even with dealing with the root cause with people's bodies, if we look at the root cause of this issue, it goes back to a very broken education system and people pulling the strings all the way down, the line there. And my apologies on behalf of nurses. I don't know. Can I even say that? On behalf of nurses, I apologize for people, not giving you the correct information.
You feel bad that people aren't getting it, and and I feel bad. Again, let's go back, check our hearts, and realize that the nurses and the doctors are not being given it, and they may have a good heart, but they've been so deceived into believing it, and then the frustration and even the idea to even look into the truth will literally crush a person's spirit and heart, and literally, it's been. I mean, that one doctor who committed suicide, and he didn't, and they found a note where he didn't vaccinate a bunch of kids when parents were led to believe that he did. And I'm like, so did this doctor commit suicide because he realized how much harm he had done by prior vaccinations? And he decided, I'm no longer vaccinating, so I'm going to fake this. I'm going to pretend like I am. I'm going to put it on the record so that these parents don't vaccinate their kids. And then he committed suicide out of the grief. And realizing how much harm it's like, who knows, because you can't really talk to the guy, but then they find out that medical records were fraudulently forged, that he had vaccinated the person. And again, it could have been money, and maybe did it for the money. And then he committed suicide because he was grief over the money he made out of forging, but he could have given the shots anyways and still made the money. So it's like, there was a reason that
individuals, and you don't want to do any harm. I know people can be kind of like up on what they know and down on what they don't know, and they want to put everything into a box. But that's like where humility comes in, like to always be willing to learn, like always be willing to read that research article that someone brings in. When you feel like there's nothing more you could learn about thyroid, but somebody brings you another research article, to humble yourself. I mean, like we wear these, white coats. I don't know if you do ever, but we wear these white coats and people are like look, because it's almost like a symbolic, like if you have that and you're wearing that, then you must know something. But I think sometimes when people put it on, it makes it almost like I've arrived, I've learned everything. And that is so not the truth. Like you have to continue learning. And I think you become stagnant and irrelevant and dangerous to your patients when you stop learning and reading and listening. Like, and like, I think of Jesus in the Gospels, and like his biggest superpower and how he healed people is like he listened to their whole story, the whole thing. And that can take a lot of time. But it is effective.
And he would give them what they needed, not just what they wanted.
Right.
Like that's what we need to do as doctors. Like if we're really about healing people, we need to tell people what they need to hear, not what they want to hear.
Right.
We need to direct them in the direction. And I tell patients, I'm like, I can show you the path. But the reality is if you don't walk it, there's nothing that's going to change. Right. So I can't pull you. I'm not going to push you. I'm not going to force you. I'm going to lay it out there and say, this is what I would suggest you do. And if you want to do that and you want your health back, this is what you need to do. I don't care if you like a glass of wine every single night and you're allergic to brewer's yeast or whatever. You know what I'm getting at here. I don't care if you like ice cream and your kid is going to scream his head off if he doesn't get his, dairy, and he doesn't like almond milk or whatever it may be. We have to. The whole system needs to change, and whether it's going to change or not, or whether it's going to get worse here, I think like from the full circle, there's a battle going on right now, good and evil. Who's going to triumph in this time? Are we going to have a reset in our society and all of a sudden good things are going to come about in the future for a time period? But biblically, we have to realize that things will get much, much worse in the end times. And so I'm sitting back, this guy that's in the CDC and he was fired. People are like, bye-bye. The guy heading up the vaccine study and development of this vaccine. I'm like, what if they're just replacing him with somebody more corrupt? I'm like, we don't know why it was fired.
Too. Like the next pharaoh was worse than the one before. That happened routinely. So I'm a little nervous too. A few people have sent me messages like, "Oh look, we won. He got fired." I'm like, "Oh no."
I'm like, I'm pretty sure he was not the one orchestrating everything.
No, and maybe it's to even things like that are to make people feel a little bit of false sense of reassurance. I'm like, oh no. This is still real, and we're still going to be faced with some difficult situations in the coming year. So hope to keep putting out the truth so people have what they need.
You and I will both try and do that the best we can.
Yeah.
And hopefully more people will join us. And even if it's a conversation, I've seen somebody's comment where they're like, it's just hard to speak and hard to talk. And it's like, ask questions, prying questions as simple as the Event 201 or as simple as did you hear about the CDC whistleblower, William Thompson, whatever it may be, right. Things that are like prying enough that aren't like, you're not telling, you're just asking. And then you can be like, hey, I'm not conspiracy. That's ironic. Don't you think? Ask questions, engage in conversations with friends, family, and do it in a way out of love. And then at times stand up and flip over tables and crack a whip like Jesus did when you need to. If somebody decides your church needs a flu vaccine campaign in your church, make sure you're flipping that table. I tell you what.
Oh, wow. Is that happening?
Oh, it's happened. It's happened. Yeah, I've seen that stuff. So there's a time for righteous anger, and there's a time, and the majority of the time we need to bring about love. And so I know that we're going on an hour here. I told my kids they're going to grandparents this weekend, so I've got to get going. So Janie, thank you so much. I think people quite a bit of bits and pieces there, and it was almost more thought-provoking. I think our conversation was more than just data-driven and technical stuff.
Yeah.
But I think hearing from an ICU nurse to realize that, you know, you had seen on the inside really the pitfalls and failures, you know, of medicine and emergency care. And now that you're truly on the front lines preventing issues, you know, preventing people from going down that path, preventing people from ending up in the emergency room. By doing that, you're really having a much, much larger impact on many more lives. And we need both. We need nurses in both arenas.
For sure.
I think, you know, anyways, but thank you so much. I will chat again about possibly doing one where you kind of walk us through CE trainings on vaccines and the HPV vaccine. I'd like to hear more about that. I'm sure other people will too. So
yeah, we'll love to do that. You have a great weekend, Dr. Dale. Thanks everybody for
you as well.
That was lovely to see all those awesome comments coming up. So
yep.
All
Awesome,
right,
Jamie.
care.
We'll see you. Have a good weekend.
You
God
too.
bless.
Bye-bye.